Welcome back to What's Now, continuing to focus on your health, but specifically women's health. September is Sexual Health Awareness Month, and I have Dr. Jackie with me recently. We had a great conversation about women's health and what women can do to feel empowered in their health and wellness. Here's more.
September is Sexual Health Awareness Month. OBGYN and host of the Women's Health Podcast, Dr. Jackie's Point of View, Dr. Jacqueline Walters, aka Dr. Jackie, is here to clear up the myths and misconceptions, the subject, and to empower women to speak up, ask the right questions, and get the facts on taking charge of their bodies. Thanks for joining us, Dr. Jackie. How are you?
I'm doing wonderful. Thank you so much for having me.
So what is one of the biggest misconceptions that you hear about women's sexual health?
Absolutely. One of the biggest misconceptions, and one we need to get rid of, is that the vagina should smell like flowers and fruit. That is so far from the truth. The vagina has its own natural odor. See, the vagina has a pH of 3.8 to 4.5, and if you disrupt the pH, and one of the biggest disruptors is sex, you can find a strong or an unusual odor from the vagina. Now, if you experience that, I personally, and I tell all my patients to use Refresh Odor Eliminating Gel, and the vagina will be happy.
Any other misconceptions that you hear regularly?
Absolutely. Another big misconception is the vagina is unclean or unhealthy. That again is so far from the truth. The vagina itself is a self-cleaning organ. It's actually cleaner than the mouth. I liken it to a self-cleaning oven. The vagina will cleanse itself. You can help by using warm water and a soft cloth or your hands, but you don't need harsh chemicals, you don't need soaps, and you don't need anything other than that to help with the vagina cleaning itself.
How can women take charge of their sexual health?
That's a good question. Now, I encourage women to definitely increase their VQ. You've heard it. Knowledge is power. The VQ is your vaginal IQ. When a woman is more comfortable and more confident and has less fear, she's more likely to ask those questions open and honestly with her OBGYN. I do encourage women to find a doctor, though, that makes them comfortable, and gives them their full attention, and just make it okay to ask and not feel judged. And I promise you, your vaginas will thank you later.
What are some of the questions that you wish your patients would ask you about their sexual health?
Yeah, I do wish women would ask me more about vaginal discomfort, especially vaginal discomfort after sex. Burning and itching after sex is not normal. Now, if you encounter that, though, I do recommend, and I do personally use, Refresh Cooling Relief Spray. A pss of that, and oh my God, your vagina is calm.
And where can we get more information about all these great tips?
I want you to go over right now to refresh.com. Lots of information there, lots of resources to answer those questions that you may not have thought to ask or you were a little shy about asking. And there are videos of me over there answering a few of those questions.
Perfect. Well, thank you so much, Dr. Jackie, for joining us today. Really appreciate this important conversation about women's health. Thanks for your time.
Thank you.